So we've been talking about the need and the importance of vaccination, but I think it becomes, again, strengthening our community is we've got to own this one. And so Vax Up 815. So we've been asking and gathering testimonials from members of our community, from different parts of the community who have been vaccinated to provide a testimonial of their experience. Again, we know that there's time. This is a new vaccine. We're in a new era. It's a pandemic. We're learning more every day about it. But it's important that we share our experiences with each other and that we carry each other through this experience, that we're honest about those experiences. And again, it's important for us to see people that represent who we are and our communities, so that you may know someone personally in one of these events that will show you the important decision it was for them to vaccinate. So again, we've got to strengthen our community means each one of us reaching out to help our community get vaccinated. I've talked before, well, the light is at the end of the tunnel, but that train is coming down that tunnel behind us. So we need each one of us to reach out to others to help make sure they are registered. You heard Cheryl talk about the importance of helping other individuals who may have technology access issues or concerns about registering on a computer or using their phone, to help share and get them registered. We've got to get vaccinated if we want to slow the spread of COVID-19. We've seen our cases increasing and the positivity rate continues to rise. Now is the time. Don't wait to vaccinate. Vaccinations are now open to anyone 16 years of age and older. We have two products. Only one product can be used for those that are under the age of 18, which is the Pfizer product, and we are using that predominantly at the community-based vaccination site at Sandy Hollow. Unfortunately, the Janssen and the Moderna are only licensed for 18 and above. At this time, we recognize that many people want to choose their vaccine, but remember, we're very carefully matching the individual with age and location so that we can vaccinate 16 and 18-year-old, up to 18-year-olds safely and effectively at that location as well. Please take the first available appointment and follow up with that same provider for your second dose if you need. I cannot tell you how many people we take phone calls from every day looking for a second dose, finding out, do we have that vaccine? How do they get a second dose from a first dose that they received elsewhere? So please make sure that you take the first available. We've got a very small window in which we can get ahead of the variants in our community. So again, strengthen our community through vaccination. We also need to strengthen our community through testing and treatment. We've talked about this before, and we looked at the rising positivity rates. Well, testing is down, but those who are testing positive. The testing site at Sandy Hollow is open on Monday, Wednesday, Friday, and Saturdays from 8 to 4. There's no reason to delay testing. The most important thing you need to do, though, is if you become symptomatic and you test positive, you need to isolate and consult your healthcare provider about the treatment options, about the monoclonal antibody treatments, which can prevent hospitalization and death. So again, strengthen our community through testing and treatment. COVID is not over. As a community, we can slow the spread and we can help advance the bridge between phase 4 and phase 5 of Restore Illinois. And I'm going to give us our numbers for today, and they're very concerning for all of us. We're reporting 108 new cases in age 2 years to 84. The increase over the past 2 weeks have been driven by individuals predominantly between the ages of 20 and 39 years of age, which is similar to national trend data. It's being driven by measures of increased mobility, or what we commonly refer to as travel. Spring break, spring holiday, moving around the region. And as we know, we're tracing down that variant. The predominant variant in Illinois right now is the B.1.1.7, which is also known as the UK variant. It spreads more quickly and easily than the other variants. And right now, the CDC is reporting that it's the most predominant strain right now in the United States. Also as a concern is that hospitalizations in Winnebago County and the region have been also increasing along with the increase in cases. When you look at the new CDC COVID-19 data tracker, the level of community transmission in Winnebago County is rated as high. So again, as we talk about strengthening our community, we have to continue to wear our face coverings when outside of our household. We need to continue to wash our hands frequently. We need to continue to maintain 6 feet of social distancing, avoid crowds, limit contacts, stay home when you're sick, and Vax Up 815. And with that, I'm going to turn this over to Mayor McNamara.